Hello everyone, I am Dr. Richa, consultant Obs in Gynae from Medeor Hospital, Dwarka, and today I am here to discuss the role of magnesium in pregnancy and its clinical outcome. Let's go to the basics of the magnesium. Magnesium is one of the 10th essential metal in the body, and total amount of the magnesium in average 70 kilograms of man is about 24 grams. It's play important role in protein synthesis, and it causes bone formation. It assimilates calcium into the bone, and it contributes activation of vitamin D. So there is some interesting fact about the magnesium. Magnesium is a macromolecule like calcium, and like calcium, magnesium deficiency is most unrecognized as compared to the calcium because its severity of the symptom do not correlate with the magnesium levels, right? So the normal serum level in the of the magnesium is 0.7 to 1 millimole per deciliter. Magnesium is the second most cation, which is intracellular. Mostly 99% of the magnesium is intracellular. It bonds with the protein, it bonds with ATP, and only 1% of the magnesium is extracellular. That is why the serum level of the magnesium is not a reliable indicator for reliable test for the magnesium deficiency. So there are so many causes of magnesium deficiency, mostly due to decreased absorption from the gut, like chronic celiac disease, intestinal resection, non-renal causes like chronic diarrhea, chronic vomiting, renal causes through the increased losses through the kidney. So out of which pregnancy and lactation is the condition where the renal losses increases. It increases almost 20% of the magnesium loss through the kidney, and other is endocrine like diabetes, etc. So let's directly switch over to the magnesium deficiency in the pregnancy. So there is lots of cause which causes magnesium deficiency in pregnancy, like increased fetal requirement, changes in the maternal tissue, and as I said, renal losses through the kidney in pregnancy increases, and most important, which is more common in women, is decreased dietary intake of the magnesium. Maybe low socioeconomic status, maybe poor intake of the magnesium because of sometimes maybe tantrums of the women, and sometimes maybe fuzzy women, I don't want to take this, I don't want to take this. So this is the major cause of the hypomagnesemia. Now the question arises, does hypomagnesemia affect pregnancy? So here's the answer. Answer is yes. Definitely, magnesium affects the pregnancy. Very important role in the development, and it has effects on the tissue, which affects the outcome of the pregnancy. So it's a hypomagnesemia is a common event in the pregnancy. It causes long-term effect on the fetus, and it causes change in the outcome. So magnesium deficiency will cause changes in the pregnancy, like PIH, pregnancy-induced hypertension, preterm, or IUGR we can say, and decreased fetal weight, preterm labor, and etc. So there is lots of studies says that magnesium deficiency will causes increase in BP, and when we supplement the pregnant women with magnesium, we can cause decrease in BP, increase in fetal outcome, increase in fetal weight, and decrease in peripheral vascular resistance. So out of which two important studies done by Azmi et al. Or McBride et al. They says that magnesium supplementation in the pregnancy will cause decreased BP and increase fetal outcome, fetal birth weight, and will cause decreased peripheral vascular resistance. How does magnesium affects the PIH, pregnancy-induced hypertension? So it acts on at two levels. One is endothelium, other is muscles, that is smooth muscle. So through endothelium, it increase endothelial nitric synthetase, which increases vasodilatation, which causes decrease in peripheral resistance and decrease platelet aggregation. And through the smooth muscle, it decreases calcium activity and it decreases voltage gated calcium channel activity. So thus it causes vasodilatation. Through this all the mechanism, 2-3 mechanism, it causes decrease in hypertension, right? So magnesium acts as calcium antagonist. It regulates cardiovascular homeostasis. Any change in magnesium will cause endothelial dysfunction, which leads to vasospasm and increase in BP. So increase magnesium in the diet or supplementation, we can reduce the peripheral vascular resistance, we can increase renal flow, we can increase GFR. Through this, we can improve the pregnancy outcome in patient with PIH. So it may affects the baby, hypomagnesemia may affects the mother and fetus and newborn. So these are the important role of magnesium in PIH. Treatment of preeclampsia. Some studies says treatment of preeclampsia with magnesium will decrease chances of eclampsia by almost 50%. It's a huge number, right? So and it also decrease in newborn, in fetus, hypomagnesemia will affect the condition of the baby. It will lead to metabolic syndrome in later on the life. So now we switch to the another condition in the pregnancy which improve with supplementation of magnesium, that is GDM. So how does magnesium affects the sugar levels in the pregnancy? So when we decrease intake, when there is a decrease intake of magnesium, when there is increased loss of the magnesium, it will cause hypomagnesemia. That decreased level of magnesium will cause beta cell dysfunction. Beta cell in the pancreas which secrete insulin. So that cause beta cell dysfunction, and it causes low grade inflammation, and it impaired activity of insulin dependent kinases and magnesium dependent carbonate metabolism. So through this all the mechanism, it increase the insulin resistance, which causes increased sugar level, that is hyperglycemia, which further leads to type 2 diabetes, which affects multiple organ of the body like kidney, like cardiovascular system, like nervous system. So by supplementing with magnesium, we can improve the insulin resistance, which causes decrease in sugar level, and improve the outcome in pregnancy with GDM. So definitely magnesium supplement will improve the outcome. So now another condition, this is most important and highly ignored by female, which is the muscle cramp in the pregnancy. Yes, there are some condition where muscle cramp in the pregnancy. So definitely magnesium acts as a calcium antagonist, right? And it stimulates vasodilatation through nitric oxide and prostacyclins, and improves the blood circulation towards the muscles. So and through this cycle, it improves the muscular cramp. Another role of magnesium in muscular cramp is through it acts as a neuroprotective method. How does it act? It acts on the nervous system. It stimulates, it stabilizes the transmission. It inhibits the neuromuscular transmission. Thus, it improves the cramps of muscles. Thank you.